The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, My Bariatric Solutions features their mobile lap band unit to help patients with their follow-up lap band appointments. ENT Dr. C.T. Wynn treats his patients' chronic sinusitis. Facial plastic surgeon Dr. Yadro Ducic gives his patient a more balanced face with rhinoplasty and a chin implant. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Well, I played football in the NFL for 15 years until I was 40 years old, and by the end of my career, in the last few years, my knees ached a lot. I wore a knee brace, and just from all the wear and tear over the years, just the pounding the streets and stadium stairs, and they were just pretty much wore out and shot. And I was not looking forward to it, but I was looking ahead, probably have knee replacement. That's what a lot of guys do. Well, my knees were so weak, they seemed like they weren't going to hold me up. I had a hard time going up and down stairs. And they popped a lot, and they creaked, and they just need oil.
Jeff is in that age group that over time has developed some wear and tear in the knee. Jeff, being a football player, had some arthritis already progressing in his knee. It seemed that his pain was activity related. His x-rays were not terribly bone on bone, and the MRI showed that he had some decent cartilage still left. So replacements and things like that was out of the question. So we put our heads together and decided that we would try to see if the PRP would work for him.
I luckily found Dr. Bajaj. Someone turned me on to him, and Dr. Bajaj did the PRP injection to my knee, and they told me it probably should feel better in about 72 hours, and it felt great when I walked out of the office, and it's felt great since.
So what PRP is plasma-rich plasminogen, okay? Basically what you're doing is you're taking somebody's own blood, you're spinning it down and getting it to a concentrated form with a few other additives. You're putting it into the joint so that you hopefully deliver some cells to different areas in the knee that can hopefully form some cartilage and some scarring along the bone so it's not grinding.
It was a surprisingly short process, and it was easy in and out. I felt a lot better walking out than I did walking in. I'm able to work out again, finally. I've gained 40 pounds since I played football, and I've been able to lose 15 pounds since I had the injections. I'd do it again if I was in the same situation.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patients' success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap bandwagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
Being a cosmetic dentist, it really affected me as I was looking inside the patient's mouths. I wasn't able to breathe, which made me tired and gave me a headache. And it really affected me being able to work on patients.
He wasn't able to breathe out of his nose for the past 20 years. He has this nagging problem of post-nasal drip, congestion, and facial pressure. Dr. Casaberry has tried everything, and he is frustrated with the circle of antibiotics and medication. He consulted me because he wants a permanent solution to his problem.
My first impression of Dr. Nguyen was, wow, amazing. He brought me back, he showed me the problem. He actually diagnosed me having a deviated septum, which means my nose is kind of crooked upside in there. But I really liked how it was very personable and I didn't feel as though a number. It was really great.
Dr. Casaberry is an appropriate candidate for in-office balloon sinus dilation. Balloon sinus dilation is an FDA-approved procedure that uses a small balloon to open obstructed sinus drainage pathway, similar to the procedure used to unplug arteries that we call angioplasty.
The whole procedure was great. I came there that morning, he did the procedure, and it just really changed my whole life while working on patients. I don't have the clogged nose, and I'm glad I did it. Very glad I did it.
If you want to have decent hearing when you're in your 90s, you can exercise your ears. Simply turn on some music and practice singling out a single instrument and listening to it. This exercise can help to hear more details in everyday sounds.
I've done dance a majority of my life, ever since I was about 2.5 when I first enrolled in tumbling. And over the years, with mirrors and makeup and performing, I kind of realized something's wrong. I noticed my nose was not always the best it could look.
Well, rhinoplasty essentially means reshaping the nose. When you look at the nose, it's in the middle of the face, and we don't really want to draw attention to the nose, whether it's positive or negative. The whole point is you want people to look at your eyes, you want them to look at your smile, your mouth, your overall facial appearance, and the nose you don't want to be a distraction. In terms of aesthetics, you really want to make the nose fit your face.
Dr. Duchek is very open, he's extremely funny, he's very relatable, he gets very involved with his patients. He really tries to figure out how and what needs to be done to get the achieved goal.
In terms of when to have a rhinoplasty, appropriate age is when patients are mature enough. You have to look at the facial features and facial growth. Sometimes you can do corrective nasal surgery on patients as young as 13 and 14 if their facial features are fairly well developed. Sometimes they're not ready till they're 17 or 18 or 19, and so you really have to individualize it. It's important to have a nose that is appropriate for your facial dimensions. You don't want a nose that's too small and somebody with wider cheeks. You don't want a nose that's too large or too prominent. And so it really is a matter of balancing it with the rest of your face.
He explained to me that, the balancing my face was off. He not only recommended a full rhinoplasty job for alignment on my nose, but he also recommended a 4mm implant to my chin in my jaw, so that it could help balance out my face. Now, to this day, about 4 or 5 years later, it has definitely made an improvement. I'm definitely more confident. And now with my greater confidence, I've actually been able to have some modeling opportunities and gotten to actually show off my new presence and appearance.
Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, Houston Northwest Medical Center features its breast center. Minimally invasive spine surgeon Dr. Douglas Wan talks about his approach to spine care. Interventional cardiologist Dr. Annie Varghese discusses the signs and symptoms for severe carotid stenosis. Cosmetic dentist Dr. Guy Lewis gives his patient renewed confidence with her new smile. And doctors from Forest Park Medical Center utilizing the latest in technology and techniques.
Here at Houston Northwest Medical Center's Breast Center, we focus on the patient and giving them the best quality care possible. The Breast Center here at Houston Northwest is a comprehensive breast center, meaning that not only can we do screening mammograms, we can also do the diagnostic portion, ultrasounds, MRIs, and biopsies.
I'm currently the medical director at Houston Northwest Medical Center. My primary role is interpreting screening and diagnostic mammograms, breast ultrasound, and breast MRI for detection of breast cancer. Also to determine clinical issues. If the patient comes in with a palpable lump, we want to find out what it is. Doesn't mean it's going to be breast cancer. It may be a simple cyst, it may be a benign tumor, but that is part of the workup that I'm involved in.
All of our nurses are certified nurse navigators here. They help the patient walk through the system, whether it's just for a screening mammogram or all the way through surgery. They help them navigate their care.
At Houston Northwest Medical Center, we have 4 breast patient navigators. We are very fortunate to be able to do what we do. Very few hospitals in the area have the opportunity to have this many nurse navigators, and from the beginning, from screening, from going out into the community, it's all about deliverance of care and continuity of care. So if you just make sure that that care is not broken, then one passes a torch to the next person to make sure from the time that she got her biopsy, from the time that she got her diagnosis, that we actually use the library to give her all the information that she needs to arm herself before she goes to see the surgeon.
At Houston Northwest Medical Center, we're very fortunate that we have a multidisciplinary breast cancer conference every 2 weeks, so twice a month. Every patient that is diagnosed with breast cancer at this hospital will be presented at a conference that is attended by radiologists, pathologists, breast surgeons, oncologists, radiation oncologists, and plastic surgeons, and the nurse navigators.
This is an excellent way for the patient that has been recently diagnosed have a treatment plan mapped out for her by specialists that come to the breast conference.
The Breast Center at Houston Northwest Medical Center is the only certified center of excellence in Houston, Texas. We have a monthly support group called Care, Share, and Be Aware, where newly diagnosed patients can come and share their feelings. They can also bond with other breast cancer survivors to interact with them and learn from them.
We always say no one chose this journey, but if you're walking the journey, you're not going to walk it alone because we're going to walk it with you.
Find your doctor on bestdocsnetwork.com.
And we welcome you inside the Best Docs Network studio. We are happy to be joined by Dr. Doug Wan. And when it comes to spine and neck surgery, this is your go-to doctor. He is also the director and founder of Spine Care. Dr. Wan, welcome to the program.
Thank you. Thank you for having me.
Let's start it off with your philosophy when it comes to your approach to medicine. What would that be?
So we practice medicine based on, our approach is very patient-centric, providing the best care for the patient. And when it comes to spine care, spine problems are a very complex issue. And so our approach is to approach it with a very comprehensive approach. So in our center, we have from the least invasive way to the most complex way of treating spine conditions. And we have providers such as chiropractors, physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgeons. And we approach it through a multidisciplinary approach and find the best way to treat the patients so that they get the most amount of pain relief.
All right, doctor, what was your goal in creating Spine Care? What did you have in mind?
When we created Spine Care, our goal is to provide the best kind of spine care to the patients. There are many patients with very complex spine problems. However, not everyone may need spine surgery, so we approach the spine through a multidisciplinary approach, and we find the best way to treat the patients with significant back pain. That's why we have from the chiropractor to physical therapists, physical medicine rehab doctors, interventional pain specialists, and minimally invasive spine surgery. We find the right diagnosis and treat the patient the right way and the least invasive way possible so that they can get their life back as soon as possible. Also at the Spine Care, we have high-level imaging so that patients do not have to travel elsewhere to get their imaging studies done. Also, we have our own procedure centers on campus, so therefore they can not only get the evaluation, but also pain procedures done, as well as spine surgery.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress.
Ms. Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. But what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, you know, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
Henry has a question for Dr. Dan Bhakta. How do you treat heel pain due to plantar fasciitis?
Plantar fasciitis is treated with multiple different ways. Conservatively, we treat them with oral steroids, stretching exercises, orthotics, night splints, and or steroid injections. Once the conservative treatment fails and patients do not get better with them, we discuss surgical options. And one of the most common ways to perform surgery is called endoscopic plantar fasciotomy, where we release patients' plantar fascia, just part of the plantar fascia, to relieve patients' symptoms, and that works really well. There are multiple other ways to surgically treat patients' heel pain and plantar fascia is radiofrequency ablations, platelet-rich plasma injections, including heel spur resections.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
So what does a gastroenterologist treat? Basically diseases from the esophagus, swallowing tube, stomach, small intestine, colon, rectum, liver, pancreas, and gallbladder. The most typical patients that we see in the office include evaluation for colorectal cancer screening, very commonly for heartburn, indigestion, stomach pains, maybe gallbladder or gallstone problems, blood in the stool, diarrhea, constipation, very common things. Other diseases of the intestine, such as Crohn's disease or ulcerative colitis, and any diseases of the pancreas. A patient will come into me already having a preliminary symptom such as acid reflux or diarrhea, at which point I'll come in and do a full history and physical with them, a one-on-one consultation, go over all of their symptoms in detail, review their medical records from their referring physician, including labs and any pertinent x-rays, discuss things like their family history and how current they are in their colorectal cancer screening. And then at that point, we'll make an assessment and a treatment plan. It's important to see a gastroenterologist when you're having any symptoms in your stomach or swallowing or bleeding, and not just assume, oh, that's just stress or some benign condition. We can decide whether or not we need to do more investigation. Over-the-counter medicines such as antacids and things like that for reflux may help the symptoms, but may be masking an underlying disease that if you wait could progress to something more serious. One of the reasons I went into gastroenterology is that most of the conditions we see are very treatable and very curable. Obviously not all. What we'll do is take them through the process of evaluating their disease, treating them, following them, and making sure they're symptom-free.
To learn more about Forest Park Medical Center and their doctors, go to bestdocsnetwork.com.
You hear a lot about ADD in adults nowadays. A lot of people think they have it, but let me help you understand this a little bit. If you walk into a room and you can't remember why you're there, or you're having trouble getting everything done, that doesn't mean you have ADD. That means you're just kind of a normal human being. ADD is really a pretty pronounced symptom and syndrome in an adult. For example, you may be doing something at home on a scrapbook for the kids and you hear a bus go by outside or a truck go by and you lose your total focus and can't get back into it. That's sort of like ADD. Or you hear a phone ring down the hall at work and you lose your concentration on your computer screen. There are tests for ADD and there's great drugs for ADD. Here's the problem. ADD drugs, they're sort of like a form of speed. They're going to make anybody feel better. They're going to make you think quicker, have more energy, get more done. But if you don't have ADD, all you're doing is taking a drug that's speeding you up and it's really not good for your heart. So you really need to be tested to be sure you have ADD.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots and I would never, rarely would open my mouth to smile. You know, once I had the smile makeover, I'm just flashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's and my mother was across the room from me. My mother's 82 years old. And she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone. And after I feel like I can take on the world, I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.